Business news from the Capital Region. This is Washington Business Report with ABC7 national correspondent Rebecca Cooper.
Thank you for joining us for a fresh look at how business and finance affect us here in the D.C. region. Rebecca's off this week. I'm Bruce DePoit. Coming up on today's show, how are you being judged during your annual performance review? We have tips on how to make yourself shine. Also, the president spoke a lot about the middle class during his State of the Union address this week. Our roundtable experts will unpack the facts and tell us how the Capital Region will be impacted by the president's plans for his final 2 years in office. But first, our one-on-one interview this week focuses on taking on a project with the goal of making it bigger, better, and stronger, and learning from someone who has a proven track record. Robert Musslewhite is our guest. He joined the advisory board company more than a decade ago and took over as CEO in 2008. The goals were to expand, get better recognition, and have more of an impact on the community, things that many business people strive for. We want to know how he pulled it off and won numerous awards in the process. Welcome, Robert Musslewhite. It's great having you here.
Thanks, Bruce.
Tell us about the advisory board company. What do you do?
Well, we work with 3,000 hospitals and over 1,000 universities today, and what that means is we sit at the center of these industries, so we're able to collect all kinds of performance information, things on practices that work, practices that don't work, and then share that back with the industry to help carry out their mission. So we help hospitals reduce costs, improve the quality of the care they provide to patients. For higher education institutions, we help them keep students in school and eventually graduate successfully. So
it sounds like a heavy involvement in the medical sphere.
Yeah, most of our business is in healthcare. So we're traditionally been in healthcare for about 30 years, helping hospitals and health systems really improve everything that they do in terms of furthering their mission.
What sorts of goals are you trying to help people attain?
Well, today the big issue is costs in healthcare. So if we can help our institutions deliver care at lower cost, that makes them more accessible to patients. It makes them more able to provide better community care. And so a lot of our work goes to how can care become more efficient and higher quality at the same time.
A lot of discussion about cost containment in healthcare, a lot of concern, of course, and opinion seems to differ about whether we're making progress or not. Are we?
I think we're making tremendous progress. If you look at several things, obviously many more people are covered under insurance plans today as a result of both federal policy and what you see our members doing. Also, if you look at costs have not increased nearly as much as they had in prior years over the last couple of years. And I think what you see is you see an industry really embracing delivering value instead of just delivering patient care. So, for example, many of our members are looking at ways to take on the ownership of the cost for caring for a whole population of patients and saying, we're going to take care of these patients, we're going to provide better care, we're going to do it at a lower cost, and we will have incentives around doing so. And that's really the big shift that's underway in the hospital and health system environment.
Are you optimistic we'll see more cost containment in the next couple of years, say?
Well, I think we have to. The forces at work today, most consumers, patients, tend to have more and more responsibility for the cost of their own care. Deductibles are going up. On the exchange plans, deductibles are higher. Employers are moving people into high deductible plans. And so what that means is there's going to be a lot more price shopping and price sensitivity around quality health care. And so people are going to be making decisions based on what types of health care they need, and cost is going to become a part of it. So our members, all 3,000 of our hospitals, are looking at ways that they can be sure that they're going to be cost competitive in an environment where costs are going to matter a lot more. So that is going to drive costs down. Your
company, the advisory board company, has had strong growth, impressive growth. You've got thousands of employees scattered here and abroad.
Yes.
Was that the goal? Was that your primary goal when you took on when you became CEO?
I'd say it's more of an offshoot of what we've been doing, which is really our goal is to help improve the industries that we're in. So the reason we love serving hospitals and healthcare systems is that that improves healthcare, and if we improve healthcare, it's a noble mission for us. Same thing in higher education. When we did launch that business 7 years ago, I was involved in the launch, and we did it because it felt a lot like healthcare. If we could help colleges and universities improve their ability to graduate students and provide more accessible access to higher education, that was also a good. And so really our goal has been to have a greater and greater impact on the industries we serve, and that's resulted in the expansion that's resulted in our company as we continue to do that better.
An integral role for technology in the work that you do.
Absolutely. Technology, if you think about healthcare, there are all kinds of data available, more and more even as the federal government has pushed health systems to adopt medical record technology. And so today you have access to all kinds of clinical information that you never had in the past. And the big push for us today is how do you use that information more effectively to drive to better patient care. I mean, today we can help a doctor understand when he or she is seeing a patient, is that patient more likely to be readmitted later or not? And therefore, would you do something different while the patient is in front of you to be sure that you have a better chance of that not happening?
An important metric.
A really important metric. Or put in place a care plan. So when the person leaves the hospital and is now back in the community, can we monitor the activities that they're performing or that's happening to them over the next several weeks to be sure that they don't have another acute episode and maintain their health where it should be? That kind of stuff is really revolutionizing the provision of care. It's tremendously exciting.
Your company has won some notable awards, and you as an individual corporate leader have won some awards as well. Not least, you were named the most admired CEO in healthcare. With such a big company, is it possible to be to have relationships with so many employees and to be sort of tough but nice at the same time?
Well, I try to just be myself. You know, I came up through the company. I didn't start in this role. I'm good friends with my whole executive team. We love working together. It's a very collaborative team, and I think it's important for the employees to just know me as a person. So I try to get out wherever I can. Just last night I was at a dinner for people who started within the past couple of years, and they're some of our top performing new employees, and I love those dinners because it gives me great energy, and I think it just continues to validate the fact that we're doing great things with our people mission. So I don't really take the credit. I think we have a strong mission and a fantastic operation in terms of what we try to do, and that really does fuel the right kind of engagement of our employees with our company.
And in just a couple seconds, I know it's important to you to find time to be involved in the community. You're on at least one board of a nonprofit that is doing fantastic work with people who are facing significant life challenges. Yeah,
Miriam's Kitchen. That's a fantastic organization here in the community, and what I've been most proud of with Miriam's is that their mission has evolved from just helping the homeless and feeding the homeless to now really taking on the challenge, but bringing organizations together in the community to end chronic homelessness here in DC. And it's going to happen. We're on the path to doing it. It's tremendously exciting. An important and noble goal. Thanks very much for coming in and chatting with us, Robert Musslewhite, CEO. We appreciate your time today. Great having you here. Thank you, Bruce. Appreciate it.